And we're back. This time, we'll be talking about your dogs at home that can potentially help in the management and treatment of some serious health conditions like cancer and depression. I'm talking about the Dr. Dog program. And to discuss more about this, we have Ana Cabrera. She is the Executive Director of PAWS, as well as Jeng Mamiit, who is with Dr. Leo, and Jenny Panis, and she is with Dr. Eddie. Welcome to the show.
Hi. Thank you for having me.
Now, the Dr. Dog program has been around actually for quite a while now. I think since 1997, if I'm not mistaken, and it's been vital even in other countries to help with certain illnesses, lifting up people, and just their overall well-being. Could you explain more about this program, Ana?
The motto of the Dr. Dog program is actually love is the best medicine. And I think this is true in a way because when we are being treated for a condition or disease, it's not just the medicines that help us get better. It's also your combination of your doctors, the people around you, the support that you get, and the dogs that we bring this to the table. They're non-judgmental. They're very, very friendly, and you don't need to, to be anyone else but yourself in order to, feel better. So there's no stress, there's no ulterior motive from the dog that visits you. So the more that patients feel receptive. So I think this is jumping off from Patch Adams, like he wanted to make people laugh, and he felt that it was going to make people feel better, and that's what the Dr. Dog program is. It's actually making people feel better.
Now, what are some of the illnesses wherein these dog doctors are there to be able to help?
Basically, they open doors that other therapists can't open. Just as an example, in the early part of the program, we brought the very first Dr. Dogs to Hope. That's a school for autistic children. So one of the kids started speaking excitedly to the Dr. Paco. He's a German Shepherd, so he started speaking excitedly to the dog. And then, so all the teachers were amazed, and they were whispering excitedly among themselves, and they said, don't worry, they do this all the time, they talk to the dogs. And then the teacher said, you don't understand. That kid has never spoken a word to anyone since he started school here. And these were professional, like, teachers and therapists who are used to autistic children, but they weren't able to open the doors for these kids. So it was the dog that actually provided this. So after that, the therapy went so well, they recommended to the child's mother that they get a dog. And I think that time that the child stopped rocking himself and just being silent, and he was now talking more and more to people.
No, it's such a wonderful story. Now, what makes a dog qualified to be a Dr. Dog, aside from a 9-year medical degree? what qualifications should a Dr. Dog have?
Jeng could...
the dog should be 2 years old and above.
Okay.
And then he must be spayed or neutered. And lastly, he should also pass the temperament test that is administered by PAWS.
Is one of the qualifications, does a dog have to be a pure breed in order to be a Dr. Dog?
No. Because
Case in point.
just like Leo, he's an Asong Pinoy, and he's also a rescue dog. So he was rescued in Capitolio several years ago. Then after a year, I've decided to have him tested for the program.
Wow, okay. Now, what are some of the activities naman? Let's say your dog is qualified to become a Dr. Dog. What are some of the activities that the dog undergoes with an actual patient or someone in the hospital?
When we go to hospitals, we allow the children to touch them, to talk to them, and sometimes the Dr. Dogs can do things for them, like maybe high five, shake hands, tricks like that, and it really makes the children happy. And children who are scared of dogs would eventually lighten up.
Right,
and open up.
And open up to them.
Yes.
Now, do you have a message out there, Jeng, for those who are interested probably in having their dogs become a Dr. Dog?
First, have a good relationship with your pet. Kasi being in the program, you have to also know bodily cues, then he'll tell you na, I'm already tired or I need some rest. So, kailangan muna, you have to foster a good relationship with your pet prior to have him tested. And then also, it's a rewarding experience. So, kung you think your dog is a perfect fit to become a therapy dog, why not try it?
Okay. How about you, Jenny?
Well, to add to what Jeng said, it's always good that both you and your dog will enjoy the sessions. In this program, we also are able to uplift the image of the dogs because not only are they house pets, not only are they a companion, but they can help people. So that alone.
Definitely. And the final word, Miss Ana Cabrera.
In our line of work in animal welfare, it's always about people helping animals, but very few really think that animals help people. And this program shows very clearly that they help. They do the work. We even have prescription pads for them. So they have like prescription pad of Dr. Eddie, Love and Kisses. So we ask the name of the child, and the child will give it, and they really feel like it's the doctor. One time, I actually have to mention this. We went to a home for abused girls, and then we said to them, these are doctors. They will make you feel better. And so we want you, we're going to stay out of the room. We're going to put you in a room with Dr. Eddie, and you have to whisper all your problems to Dr. Eddie. And so we watched slowly in amazement. All the girls like whispered. They had tears streaming down their faces.
Oh, no.
And I think it was very therapeutic for them to be able to tell. Nobody knew what they told the dogs. But after that, I think the kids looked better. And we were actually crying outside the room because I could see that the dogs really did their magic for them.
And I'm sure animals just like, or dogs just like Eddie here and Leo do have that effect on people, definitely. And as much as I'd like to still give these guys some limelight, unfortunately that's all the time we have for today. And so I'd like to thank you, Ana Cabrera, the Executive Director of PAWS, as well as Jeng Mamiit and Jenny Panis for joining us today, and with Leo and Eddie.
Yes.
And we'd like to thank all of you viewers out there for joining us on this episode of Medtalk Healthtalk. Please do join us next time as we give you more topics that take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.